All right, so we can begin. So hello everyone, welcome to today's shadowing session. Today we have Dr. Alexander King, and he is a DO practicing osteopathic manipulative medicine. So welcome, Dr. King.
Thank you very much for having me. I'm excited to talk about what I do.
Yep, so yeah, you can go ahead and start.
Cool. Welcome, everyone. Thanks for joining. I appreciate this opportunity. Thanks to My Medical Message for bringing me on. And let's talk about what I do, my background, and then get into some kind of cases that I typically see. So again, this is osteopathic manipulative medicine, also known as OMM. All DO students take classes and have lectures and labs in OMM, and I happen to specialize in this method of treatment. And I also work at the Shin Center of Integrative Sports Medicine in Cherry Hill, New Jersey, and that's a private practice. So let me go to the next slide. So my background, I went to undergrad at Muhlenberg College, double majored in neuroscience and sculpture. I then went to PCOM, where I got my DO degree, 4 years of medical school, and then 3 years of residency in OMM, which is osteopathic neuromusculoskeletal medicine. And that means that's essentially the ACGME term, since we're both AOA and ACGME dual accredited. That's like the specific term for the program. And that was also at PCOM. And then while I was in residency, I did a medical acupuncture fellowship at the Helms Medical Institute. Also, my current practice is a private cash-based practice, just a flat rate for new patients and then follow-up patients. And we don't itemize anything, no separate charges. It's just one single fee, and then we do everything we need to do in that appointment. And again, it's in Cherry Hill, and I work 40 hours a week. There's no call, and it's all outpatient-based treatments. So here's just a snapshot of our lobby and what it kind of looks like when you enter. So what is integrative sports medicine? This is a term coined by my colleague, Dr. Shin, who founded this institute. And he believes that integrative sports medicine is a combination of various treatments that harness the power of natural healing in the body. And we use these treatments in conjunction with each other to find the best way to heal each specific patient. So some questions here. Would you say that being a DO who works in OMM, am I able to have a deep relationship with a patient? Yes, absolutely. Human touch is very bonding, and I get to know my patients almost as like friends and family very quickly. And typically I see people once a month or so. So it's a very kind of routine follow-up. Common cases I see are like musculoskeletal injuries, chronic pain, fibromyalgia, functional organ issues. That's where I bring in the acupuncture, and chronic trauma. Modalities, OMM, obviously, acupuncture, prolotherapy, trigger point, ozone, and PRP are kind of my workhorses, and as well as cupping. A lot of patients like that too. So I'll answer some of these questions here. How do you feel about osteopathic philosophy? Do you feel as though it is an important part of everyday practice? I would say without osteopathic philosophy, I would be completely lost. I'm as osteopathic as they get. I really think of every single part of the human being when I treat patients. And I think anatomy is the foundation of all of my treatments. So without proper knowledge of anatomy, I couldn't address nearly the vast array of things that I could treat. I really could fit my philosophy and treatments into just about any medical problem, so to speak. So I'm not limited at all. Why did I choose pain medicine? Was there a specific reason? And what are the risks, complications associated? So actually what I do is not necessarily considered pain medicine. Most pain medicine involves medical management, such as opiate management, neurological medicines. I actually don't really prescribe any medication. All I prescribe for the most part is sometimes imaging and PT, but most of my treatments are extremely amicable to the body. The only real side effect I've seen is a acute inflammatory response to some of the prolotherapies and PRP, but that's actually what you kind of want in those therapies. You want to trigger some inflammation. And the main complication would be a pneumothorax, like if I were to puncture a lung, God forbid, but that, again, anatomy is everything. So that hasn't really been an issue. What are any specialties that you're interested before OMM? Physiatry, PM&R, I was interested in pretty heavily up until I started rotating clinically and using OMM in the clinic. That's when I really shifted and decided to become an OMM specialist, just because of the kind of unique ability to connect with patients, and also just my skills in OMM were getting the best results out of any kind of treatments I was seeing. Has there been an impact during my time in this career? I'm not exactly sure. I'm guessing they're talking about COVID, but honestly, no. Patients are still coming in. We sterilize each room very heavily after each patient visit. There was a slight lull during the initial quarantine, but it's been pretty good. How can I apply manipulation in your practice? Can you give an example? Yes, I will. I'll give 3 examples in the cases that I'm going to discuss here. And so stay tuned for that. What do I think is the most unique part of OMM compared to other therapies like massage or chiropractic? The most unique part is that you have a trained physician doing all of these manipulations. So other things like massage and chiro, they're not physicians. So we have a deep understanding of not only what they're coming to see us for, but also their medical management, the other possible medical diagnoses they could be seeing us for. And just really making sure that what we're doing is the proper treatment for what they have, and making sure we're not missing anything in terms of the medical aspects of their care. And I think one unique part is that we're combining essentially every type of, at least in my practice, I'm trying to combine aspects of myofascial release, trigger point, cranial osteopathy, a lot of various things and different modalities that most of the times one practitioner can't do. So I'm kind of like a jack of all trades in that regard. What are the main differences between what I do and a chiro? Main difference being the medical training, since I have all the same medical training as an MD, but also a lot of the ability to make adjustments and to do HVLA like a chiropractor can do. And also the fact that I can incorporate acupuncture as well. And a lot of these modalities and injections chiropractors could not do because they're not physicians. So essentially I'm like a one-stop shop for just about any manual intervention, musculoskeletal, non-surgical intervention, orthopedically. What led me to choose OMM over other fields? I would say my love for osteopathy and osteopathic manipulation. It's a very unique way of looking at the body, of understanding the body and medical philosophy, especially. Very different philosophy from allopathic medicine and other types of medicine. And I think the real emphasis is the ability to search for the body's healing ability, and understanding that you can actually shift the body towards a healing response naturally. You don't have to rely on medicines or all these other things that can just mask symptoms. You can find the root cause of what's creating an issue physiologically and anatomically, and create the right environment for the body to heal itself. And that's ultimately what I try to do with my patients. And it's worked really well for a lot of chronic cases and a lot of refractory cases. So let's get back to the PowerPoint here. The first case is a knee osteoarthritis case. This is a longtime patient of mine, treated her maybe 20 times or so over the years. And she's a 56-year-old female with a history of bilateral knee osteoarthritis, moderate to severe on x-ray, and it's pretty much bone on bone. And she's had it for 20 years. She takes NSAIDs occasionally. And she's a veteran fencer that still competes monthly. So she's very competitive and is willing to kind of play through pain, so to speak. I treat her about once every few months when the pain is increased as like a maintenance. She's got corticosteroid injections before with mild relief, and her surgeon advocates for knee replacements. He's advocated for years, but she's been avoiding it as long as possible. She's relatively young. She's in her 50s. So, again, being very active, she wants to avoid that 6-month-ish recovery period because she's so active and competing, and she's able to still compete with the treatments that I do. So the treatment itself, when she comes in, is that I begin with my osteopathic manipulation and eval, all manual, just getting a lay of the land in terms of her anatomy at the time, making sure her lower extremities and her hips are aligned. And then I decide, do we need to go intra-articular this appointment, which I do maybe once every few months for her, either PRP or prolotherapy based on where we're at. And then I always add ozone at around 52 gamma to the injection. And that's something, the ozone therapy is something a lot of other physicians don't really know how to do or don't really understand. So that's another specialty that I do. The trigger point and prolotherapy injections in the affected muscle tissue, because her case is so chronic that she's been developing a lot of trigger points and muscle tension because it's trying to fulfill the same function as her connective tissue and ligaments structures of the knee because of that arthritis. So again, it creates a lot of relief to get these muscles nice and relaxed. And then I finish with electroacupuncture at a lot of those similar points to then affect the neurological component and the get the natural endorphins and enkephalins and dynorphins of the body involved to create a more anesthetic-based effect, as well as a muscle relaxation effect, increasing that parasympathetic drive. And I use a 4 hertz frequency for chronic pain for that. So here is a picture of an example of a PRP intra-articular. This is not her specifically, but again, this is pretty much the approach I take. I take the anterior lateral approach, which is, not super difficult to do. I don't use ultrasound at all, and I'm just able to palpate and look for the correct, point to inject. So I've had a lot of training and success with that. And here is her acupuncture setup. Sometimes I'll do an anterior-based approach for the most part, but also you can do a posterior-based electroacupuncture approach if you want to target more of the gastroc hamstring complex and some other points. I won't do both in a treatment because that would take too long. So typically this is a 20-minute finishing touch on the treatment where I would then be seeing my next patient, and then my MAs would take the needles and stim out for me. But here is kind of a typical finalized treatment for her, what it looks like at the end. All right, let me just make sure there's, okay, no other questions for now. A shoulder pain case, 26-year-old female, and this might sound familiar to a lot of you students out there. She had right-sided neck pain and shoulder pain for 3 days, radiating to the elbow, mild weakness in that right deltoid, and sharp medial scapula pain, which is right where her levator scap and rhomboids are. She doesn't take meds, tried NSAIDs for pain, as most of us do. We want to get something acute like this. And she is a college student that is suffering from very high stress and anxiety due to finals. Never had needlework acupuncture before, but she is unable to sleep and could not turn her head to the right, and the pain is about an 8, so pretty severe. So the treatment approach for her is, again, I always begin with OMT, osteopathy to the upper extremity and neck to treat her somatic dysfunctions, which were a C2 through 7, side bent right, rotated right, group segment kind of dysfunction. Then thoracic outlet was restricted, as well as her rotator cuff was restricted. I then did trigger point and prolotherapy injections to the affected muscle tissues. Again, they're traps, rhomboids, levators, rear delt, and finished with electroacupuncture to her shoulder. Had a hertz frequency of 100 hertz this time because it was acute pain, and higher the hertz is better for more acuity. So here was kind of her referral pattern. She had, again, these trapezius trigger points and levator trigger points going to the neck and shoulder. And it was the right side, so that's kind of where I focused the electrical input. Although you do see points on the left side as well, because I like to treat in a balanced manner with acupuncture. As you get acupuncture training, you start to understand that balancing is very important of the body. And I also have some ear points because the ear itself is a homunculus for the rest of the body. So you can actually find shoulder points within the ear to affect the central nervous system input. So I included that as well. And third case here is a full body tune-up, so to speak. So these are my patients who are more maintenance kind of style, who might be athletes or who don't really have super chronic dysfunctions or very acute problems, but they're just here because they feel misaligned, so to speak. So she's a 27-year-old female, past history of left knee pain and bilateral shoulder tension because she does Ninja Warrior, and she's been on the show multiple times. She takes no medications. And again, she's competitive at Ninja Warrior. She's a gymnast and a parkour enthusiast. She has sustained multiple traumas and falls daily due to her hobbies, and currently not experiencing acute pain, but just feels misaligned throughout her whole body. So again, my approach, starting from the foot up to the head with OMM, beginning in her lower extremities, then working on her knees, up through the hips, rib cage, shoulders, neck, and head. And then again, trigger point and prolo to the affected muscle tissues and ligament structures. Mainly for her, it's her rotator cuff bilaterally, and her left hip flexor seems to always be involved. And then I finish, again, electroacupuncture, full body, this time posteriorly, with a Hertz frequency of 7 Hertz. And I like this Hertz frequency for global balancing. So here's her treatment. And again, this is actually in one of my clinic rooms. That little keyboard looking thing is the electrical stimulator that is pumping out 7 Hertz frequencies to the leads, which I've got mostly on her traps, rear delts, and also her glutes, because most of my athletes, I activate glutes because they are the major drivers of the body, biggest muscle group. And I just like to get the glute medius especially re-stimulated and reset, because that'll just improve their overall performance. So again, this is more of like a full body tune-up. And then I've also got the infrared heat lamp on her knees, because those were kind of swollen and bothering her. So I deliver heat to my acupuncture inputs to then increase energetic inputs to the body and the fascia. So yeah, that's kind of like a routine tune-up treatment. So we've got a chronic knee case, an acute neck shoulder case, and more of a maintenance style athlete here. All right. So again, that was my quick little presentation, so we can have about 10 minutes or so for questions. If you have questions after this as well, don't be afraid to shoot me a DM. That is my Instagram handle right there. And I will stop the share here. So let me see any other quick questions you guys have. Let me go up here. So what led you to choose OMM over the other fields? I might have answered this one. Again, it was because it's just what I gravitated towards, what I found I was good at, and the fact that I could combine so many different modalities on top of OMT, and as OMM was such a great foundation, I wanted that specific training in palpation and manual healing. So that's kind of the route that I went. What is the most interesting case that I've ever experienced? How has COVID impacted my work? So most interesting case, I would say, is a case of a woman who she started becoming aphasic and stopped having the ability to speak properly. And she was in her late 70s, and she had received about 3 MRIs from UPenn, from Jefferson, from some of the top medical centers in Philly. Absolutely nothing found on MRI. But she was still having really bad difficulty speaking, especially on the phone. But you could definitely tell her speech was very slow, lethargic. She couldn't find words. And after the first treatment, we focused with acupuncture, and then her recalling the emotional events in her life that happened when this started. So when this started, no one really asked her about this, but her brother had been diagnosed with colon cancer at the funeral of her mother, who she spent plenty of time with at the hospital before her death. So 2 major life-changing occurrences. And then all of a sudden her speech started to go. So when we treated her with acupuncture, I specifically asked her to start thinking about her brother and her mother and her relationships with them while she was receiving the acupuncture. And after a couple treatments, her speech pathologist really noticed big changes in her word finding abilities and in her pronunciation and cadence. So that was, I think, one of the more interesting cases I've seen. Again, just the power of acupuncture and the connection of the spirit, mind, and body in a way that can really help a specific case. That's something that I definitely took away from that. COVID, how has that impacted my work? Again, really, it's just I'm now wearing, masks, of course, and we're sterilizing each room with ozone at the end of the day because that's been shown to be really effective at killing pathogens. And yeah, we're just wiping down the rooms and everything after each patient. So that's really the way that it's impacted me, but otherwise, not so much. Are there any specific techniques that you use in OMM that are really helpful to help the body heal itself quickly? I would say it depends on the case. It all depends. Everyone's very different. Um, I'd say high yield techniques that I use a lot are suboccipital release is always just a great overall parasympathetic technique that's very simple and effective. And I gotta say, I love, thoracic HVLA is definitely a good, a fun one to do because you can get that rib back in place, and the patient definitely feels relief right afterwards. So in terms of quickly healing an area, the HVLA techniques are definitely good. And those are kind of like the original techniques that AT still used, and that a lot of the old school DOs used as that quick impulse adjustment. But it's good for certain cases. However, not every case needs it, I think. And why do you use electroacupuncture rather than plain needle insertion method? Great question. And I don't always use electroacupuncture. So a lot of patients, for example, I have a Crohn's IBS case where I don't use any electricity. I use the needles just themselves because it's more of a dispersion treatment. So with needles, you can actually use a tonification method, meaning an input method versus a dispersion method. If there's too much buildup in the body, if it's too yang, so to speak. So there's yin and yang in Eastern philosophy. So if the person's exhibiting really highly sympathetic symptoms and very yang in nature, you just get that vibe from them. I wouldn't use electrical input because that's actually putting, again, too much actual electrons into the body. So I would rather use a dispersion method or just a plain needle insertion and then shut the lights off and leave for 20 minutes just to let them release whatever is inside. So again, it sounds very abstract and very kind of like weird, but after you do this for a while, you just have that sixth sense of, okay, maybe I don't want to do electro on this person. Certainly my high level athletes though, who need just that extra little oomph, that extra little input to get their muscle, because their muscles are so hypertonic and so tight that they sometimes really need that extra assist of the electricity to just deactivate. So again, different cases, different needle inputs, and that comes with both good training and good experience over time. And that's why I love what I do, is because you really develop a sixth sense of what is going to help this person. And I think in a lot of other fields, they're more algorithmic and more just like cut and dry. But for what I do, there's like a lot of areas to explore and a lot of things that are not really well known, and you have to kind of get creative. And that's what really drew me to what I do, is just that creative outside the box aspect to figuring things out. Because my most common patients are people who've been to 5 specialists who have no clue what's going on still and can't find answers. So what I like to provide them is like hope for actually getting better, and then proving that with the methods that I use. And they also like not taking meds because I never write for pills. So it's just nice to heal people with what I do naturally and with my own hands. So yeah, so I guess if there aren't any more burning questions for you guys, or I got another couple minutes here, but yeah, that's kind of what I do. And unfortunately, I know I've gotten a lot of questions asking if I have shadowing students. Unfortunately, because of what I do is very private in nature, I don't take any shadowing students in the office, especially with COVID right now. Um, but I'm always, around to answer questions, or sometimes I'll show things, treatments and stuff on my Instagram, like, cases and things, pictures when I get the permission to. But yeah, so thanks again for having me on. This was
Yep.
cool.
Thank you so much for your talk. That was actually really interesting.
Mhm.
Actually, I'm planning on being a DO as well.
Yeah,
So
awesome. Yeah, I saw your message. Yeah, that's cool.
yeah. So I'm planning to be a DO as well. So it was really interesting to hear your side of how it works on a day-to-day basis and stuff too.
Yeah,
Yeah.
you'll
Thank you
you'll be
so
able
much
to
for your
help a
time.
lot of people with OMT, and they'll
Mhm.
keep coming back for more. That's for sure.
Yeah, I can imagine.
Yeah, yeah.
Yep. All right. Thank you so much for your talk today and everyone else who is still there. We posted the Google Forms, so you can go ahead and click on the link. It should close around 8:50, so try to get it in by then. But yeah, thank you so much.
You're welcome. Have a good night, guys.